Frank, just send me a chat when you think that we have everybody in, and then I'll start us.
Okay, I'm letting everybody in right now. So
Okay. Hello and good afternoon. Thank you all for joining us this afternoon. My name is Amy Baca Ohlert. I am a high school counselor and the proud president of the Colorado Education Association, representing over 39,000 educators across the state of Colorado. We appreciate you being with us this afternoon and taking the time to hear the voices of educators on this very important issue. As you all know, we are getting close to the end of the first semester, and this has been a school semester like no other we have experienced. As educators, as students, as families, there have been extreme challenges that we have all experienced this past fall as we have navigated trying to educate students in the midst of a global pandemic. Many of our districts, our educators have put in valiant efforts to educate students in this moment in time. But we have also experienced many challenges and barriers to education in the time of COVID. And we do have the luxury of living through this past fall semester and learning from this fall semester. And that is what we are here to share with you all today. We know that what we have experienced this fall semester can and should guide what the rest of the school year looks like. And one of the biggest learnings that we have had as educators is that we have experienced a lack of clear, consistent, and transparent metrics to guide decision making. We have not received that guidance from the state level, and in most cases, our school leaders have been put in extremely difficult positions of making what oftentimes feels like arbitrary decisions, excuse me, around when schools will be open safely for in-person learning, around when it should be remote learning or hybrid learning. So we are here today to share a path forward, a way that we can bring calm to the storm that we are all experiencing. We know that our students, our educators, and our families all deserve predictability. We need to have a clear, consistent, and transparent understanding of how decisions are being made so that we know when we will be in-person learning, when we need to be in remote or hybrid learning. So we are excited to have an opportunity today to share that information with you all. We have some of our local educators and local presidents of our local associations who are going to share with us today as well. So with that, I'm going to kick it over to our local president from the Poudre Education Association. We're going to have a few speakers, and then we will certainly have time for Q&A at the end of the speaking order. So John, please introduce yourself and go ahead.
Sure. Hello, everybody. I'm John Robinson. I'm a high school civics teacher, and I'm currently the president of Poudre Education Association. I'm feeling very lucky today because I just got out of quarantine myself. My wife, who is also an employee of the district, is still under quarantine and at home sick. Luckily, last night, we were able to get her COVID test results back, and they came back negative, but they did come back positive for influenza, which is really influencing our three sons and when and how they'll be able to go to school for the next couple of days. As we approach these winter months, this cycle of illness, quarantine, and interruption is only going to intensify. With positive COVID-19 cases on the rise in Colorado, We are experiencing increased levels of uncertainty and confusion around how to keep all students and educators safe. Our district leadership is not provided the clear, easy to navigate criteria that we need in order to keep everybody safe during this pandemic. I've worked extensively with the Poudre School District leadership and spoken at our school board meetings. Our district looks for direction and guidance from the Larimer County Health Department. The health department, in turn, is expecting direction and guidance from the governor. And our governor is saying the decision is left up to local control at school districts. When students and educators' lives are on the line, this circle of finger pointing exasperates the problem as rates continue to climb. We need a simple answer with clear direction for easy predictability for parents, students, and educators. Educators want nothing more than to be in our classrooms with our students. Our goal, though, is to keep everyone safe in this process. So we're working together across district lines. The local presidents in this meeting today, we started a grassroots movement to come up with a solution. Under the umbrella of the Colorado Education Association, we have a coalition of local associations that represent roughly half the educators in this state of Colorado. This includes members from Academy, Aurora, Denver, East Fremont, Falcon, Jefferson County Education Association teachers and ESPs, Poudre, Pueblo, Roaring Fork, Sheridan, and Whitefield. Our solution is simple. We need to add specific thresholds and metrics to the Colorado State COVID-19 dial for public schools. We're calling for all school districts to work with their local education associations to develop those thresholds and metrics. I'd like to introduce my friend Brooke now.
Hi, thank you. Hello, I'm Brooke Williams. I'm the president of the Jefferson County Education Association, and I'm also an art educator. We know this is what's needed right now for our communities and our students. In Jefferson County, we've been forced to move into remote learning because COVID cases are rising and quarantines are causing our buildings to be understaffed and impossible to keep open. Our district leadership and school board members have been receiving death threats and very threatening emails. Not having a clear metrics divides our schools and our communities. And this is a time that we really need to keep everyone safe and stand together. We are calling for clear thresholds now so that we can get back to in-person learning as quickly as possible. We believe in-person learning is essential for student success. So we're taking proactive measures now to increase in-person days later. We surveyed our members and we heard the same thing everywhere. In our metro area locals, in our rural locals, in our elementary schools, our middle, our high schools, in low income districts and high income districts, educators are on the same page. Together, our associations represent 1/3 of the educators in Colorado. Our members are clear in their demand for safety. 90% of educators agree that student and educator safety is our #1 priority. 73% of educators do not trust their district management to accurately report COVID cases information accurately. Only 23% of educators feel safe at school. 70% of educators say that as things currently stand, their district should move to 100% remote learning until they can follow clear and specific thresholds to allow for in-person learning to resume. And at this time, I'm going to turn things over to Tiffany to talk.
Hi, thank you. My name is Tiffany Choi. I'm a high school French teacher and I'm the president of the Denver Classroom Teachers Association. 3 weeks ago, I did a building visit of an elementary school in Northwest Denver. I spent the morning checking in on teachers and observing classes from the hallway. But a couple hours into my visit, I found out that the building was actually understaffed and in dire need of someone to cover the 30-minute lunch break for the first grade teacher. This would be the only break for this teacher for the entire day. So when the assistant principal asked if I could cover for her, I was happy to do it. But what would have happened if I hadn't shown up that day? This was 3 weeks ago when our positivity rate was much lower, and already the disruption was causing major operational failures in our schools. I can't imagine how bad it has gotten today. We negotiated an MOU about community spread metrics with our district, but actual thresholds were never implemented. So now we are coming together with other CEA unions to hold our districts accountable and call on them to implement clear thresholds. The reality is that because of community spread, we've been forced to go remote. But now the big question moving forward will be, when do we know it's safe and sustainable to bring people back into buildings? Clear thresholds and clear communication will do that. Parents, students, and educators need to be able to quickly and easily navigate the thresholds to prepare for when our schools will be fully or partially opened, when they'll be closed, and why. New York City schools are closing because they have a 3% COVID positivity rate. How high does our rate have to climb to before Colorado closes our schools? Our districts must provide clear guidance around when to expect schools to close, but also when they can open. They have an obligation to keep employees, students, and their families safe, both physically, emotionally, and mentally. And now I'd like to pass it off to Mike.
Hello, I'm Mike Mays, special education teacher and president of the Pueblo Education Association. Here in Pueblo, we are currently experiencing a drastic increase in COVID cases, ranking as high as number 2 in the nation this week in the New York Times ranking of metro areas with the sharpest increase in cases. This has hit our educators especially hard. One of our elementary school teachers ended up in ICU on a ventilator earlier this month. He has since been released from the hospital, not because he was over the virus, but because the hospital is at capacity and needed his bed. Just like Tiffany said, our districts have an obligation to keep employees and students safe. However, as COVID-19 spreads throughout our schools and community, our districts are failing us. The number of cases in our schools continue to rise, and our districts are ignoring our pleas for safety, refusing to respond to our concerns during this critical outbreak. The data being released to the community and health department is not just inaccurate, it's misleading. When our districts don't accurately report what's going on in our schools, our educators, students, and families are left in the dark. When our employees become ill, they are being required to jump through hoops in order to access the necessary leave to stay home, and are still being mandated to create lessons and teach their students while out on leave. Our districts are failing to prioritize the safety of every student, their family members, and educators. Our schools and our communities have been in a state of confusion and chaos since March. We've been responding and reacting instead of getting out ahead of this pandemic. We need to proactively and clearly tell our communities what the rules are and what to expect. We're all signing on to a letter to our local school boards and superintendents, calling on them to work with us to create, adopt, and start using an updated COVID-19 dial for schools by January 4th, 2021, the beginning of the spring semester. And back to John.
Thank you, Mike. There are many metrics that we can and should be tracking during this pandemic. But in an effort to keep it simple, we've decided to use one metric to easily navigate the dial: the COVID-19 percent positivity rate, defined by the Bloomberg School of Public Health at Johns Hopkins University as the percentage of all coronavirus tests performed that are actually positive. The dial is one example of what clear metrics would look like. It tells us clearly what kind of learning to implement during the different levels during community spread. The World Health Organization says anything above a 5% positivity in a community is cause for alarm. Right now, our state has a 13% positivity rate and growing. And our students, parents, and educators have no clear plan based on data to drive decision-making about when it is safe to be in person or when we should be in remote learning. I'm going to pass it to Amy Baca-Ohlert now.
Thank you, John, and thank you to all of our speakers. As John said, this is an example of what we need. We're letting local districts know that we are here and we are ready to partner, to work together, to create a simple dial that works and is easy to navigate. Again, parents, educators, students, all need this clear and consistent information. In absence of it, we have experienced what we experienced this fall: complete chaos, anxiety, angst. I myself am a parent to three school-age children and have experienced what it's like to not know how decisions are being made, what data is driving those decisions. So we want to work in collaboration, in partnership with our school leaders to have clear, consistent, and predictable metrics that will guide those decisions. We think the dial should have only one metric, but again, this is an example. Many of our other local associations across the state are already working with their school leaders to create metrics that will be clear, consistent, and transparent to the community to drive that decision making. We believe the plan should be created in consultation with educators or collectively bargained if there is a collective bargaining agreement. The plan should include community voice. It absolutely should include community voice. We should also talk about how often to update the dial and where the dial will be publicly viewable, whether that be on a district website, social media, etc. We want to get the politics out of our schools and out of the decision making that is happening. And most importantly, we need and want to keep everyone safe. With an updated, easy to navigate local COVID-19 dial for public schools, that includes clear thresholds, our district's educators, parents, and students will finally be able to know where we are and where we need to go. They will have predictability. No more waiting to listen to a school board meeting that goes to hours into the night to know what may or may not happen. We will have a predictable measure to tell us what the decision is going to be. If we use this COVID-19 dial for public schools, the decision to transition instruction won't make the superintendent or the school board the villain. Again, these school leaders are doing tremendous things to make school happen this fall. They too deserve to have something that guides their decision making. Educators and parents won't be the villain. We want the same things: transparency and consistency. There is a collective villain that is the virus, and together, when we collaborate and work in partnership, we can find ways to navigate through these challenging times that we are in. It is up to all of us to help get our students back in school for teaching and learning. So we're going to share with you on our screen, and I'm going to walk through quickly just again the example of what the dial could look like. Again, this would be worked through at the local level to fit the local context. But again, what we are saying here is that we need a consistent and clear metric that is being used so that parents, students, educators, and families know how decisions are being made. So again, you see on your screen a sample of the dial. These numbers are not what we are saying must be used. It's an example to show how you could place numbers along the dial to drive your decision making. So you would see in this example with these numbers that are just for example, that the level green would be at protect our neighbors, a 0% positivity rate. You can very clearly see that that would mean all schools would be open and all students would attend in-person learning. And if we move through the dial, you would see at the different levels, it would tell you very clearly what that would mean for our schools. At the level orange or the level red, all schools would be closed and students learn remotely. Again, it's predictable, it's transparent, and it's clear what's happening at each level and what that means for our schools, our students, our families, and our educators. So we just gave you a lot of information. And so now we want to open the floor for questions. The way we would like to navigate that is if you would like to ask a question, if you could please put your name in the chat. And we will call on you in the order in which the names appear in the chat. You can put your question in the chat if you would like to do so, but you could also just put your name and we will call on you and get your questions answered in that manner. All right,
Tiny, go ahead.
Tiny from the Denver Post. Sorry, go ahead.
Thank you, guys. So I'm curious, you guys are calling for something that's easy to use, but you want it to be consistent across every district. Am I understanding that correctly?
We want something that's easy to use. We want something like a dial. Now those numbers could be different because we believe that this should be worked out at the local level with the local school district and the local educators. But we need a clear, consistent metric that's being used within the local school district. So again, this is an example of what could be used. We're not saying that this must and should be used across the state. But it's a way that local districts could customize it, localize it, and then use it consistently within the district to drive their decision making.
Okay, so why percent positivity why is that the first one that comes to mind? And then if every local district is able to format it their own way, wouldn't that just lead to more inconsistency across the state?
I can field that one if you'd like, guys. So we're looking at percent positivity based on what we've seen initially from the Colorado Department of Public Health and Environment, the World Health Organization, and the CDC. It reflects what's going on in the community, which in turn reflects what's going on in our community schools in public education. And so we are looking for a consistency across the board using that percent positivity rate in conjunction with the dial. The actual number thresholds is what would be determined and negotiated at the local level, maintaining local control. And so if you look at what's going on currently in the Denver metro area, it's very different than what's happening up by me in Fort Collins or down by Mike in the southern part of our state, let alone what's happening in Boulder or Fort Morgan or Lamar. They would all be using the percent positive rate and they'd all be using the dial as their metric, but where that community needs to be on that dial and what thresholds make sense for that community would be determined at the local level.
And I'll just add to that, the consistency comes in the sense that parents and students and educators within that community know what they can consistently rely on how those decisions are being made. Right now, there is nothing that's been consistent within most school districts that everyone can rely on to understand how the decisions are being made. And it's created a lot of angst, a lot of anxiety on the unknowns of people not knowing what exactly the decisions are being based on. So this is a way to, within the community, to provide a consistent and clear metric and understanding of what they're using to drive those decisions. I think we have next up is Erica.
Yeah, hi, Erica Meltzer from Chalkbeat. A lot of school districts already have metrics and dial systems that are posted on the website where all the numbers are there. And I guess I'm curious why, how this is different or how this is an improvement. And I was also, if anyone could clarify what they mean by saying the districts are reporting inaccurate information, that would be helpful as well.
I can take the first question, right? So Denver, we've had metrics. We've had three. We were using a stoplight system at the beginning around number of cases, the trend, and the positivity rate. But the issue is that there were never thresholds attached to the metrics. So there was never a consequence for what was going to happen when we got to the red lights. And, you know, we're like probably 10 times now above what the original red light was. And we didn't see, you know, then we had lots of decisions that were made. There was a lot of confusion because some of our grades were in, some of them weren't. So what we'd like is more of a universal, clear threshold attached to the metrics.
And did any of you want to respond to the inaccurate data?
I can address that, Amy. I would suggest that these districts are doing the very best that they can with the information that's presented to them. And at the same time, when we are looking at multiple factors that go into a decision to remain in remote learning or move to a hybrid situation or return to full in-person learning, there are too many factors that are being added into that equation that don't get to the heart of the matter. There's an immediacy to this that we need to take into consideration to make sure that our communities can stay healthy and safe.
Rick from the Aspen Times.
Yes, hi. I just want to be clear, when you all are saying positivity rate, do you mean among the student body and the staff and faculty, or do you mean by the population within that school district?
We're suggesting the population within that school district because that is the population that is mirrored by the student body that we have in our school district. I think that's been a problem that we've looked at for the last couple of months, where we've said if we remove, say, Colorado State University or the University of Colorado out of the equation, that represents the actual community, when in fact, those two universities are an integral part of our community. And those members that are positive in those universities are also affecting our community as a whole.
And I could add to that, in Pueblo, the sharp increase in cases within our community coincides with the time frame in which the schools started returning to in-person learning. Our high school students were in person for a total of 9 days before they had to be put back on remote learning. So if you look at the timeline of the increase, the sharp increase in cases in Pueblo, it started when students were returning to in-person instruction.
Thank you.
Okay, Megan Lopez from Denver 7.
Hey there. A couple of questions. First is, this is kind of a stark difference than what we heard from the governor during his press conference on Tuesday. When he said that he wants to emphasize that he thinks that K-5 should return in person to school, that he feels that based on the data, that that's the safest place that they can be. So I was just kind of wondering if you can give your response to kind of what you guys heard out of that press conference from the governor. And then also, what kind of power do you guys all have to try to make the districts listen and comply? And are you willing to do something like a strike, like what we've seen nurses across the country do to get your point across?
Thank you, Megan. I'll start with that, and then I'll let any of my colleagues jump in who want to add on. What I would say is, yes, we did hear the governor say that that schools should be open for students K through 5. What we did not hear is what's needed for that to happen safely and consistently. We do know that the back and forth that many of our students, educators, and families are experiencing, because our school districts, rightly so, are implementing the school closure guidance, that when they do that and it gets to a level of the number of people in quarantine, make it impossible for the school to continue to remain open. Those are the challenges and the barriers that we are running into, as I addressed earlier, with keeping our schools open to in-person learning. I can certainly tell you, of the 39,000 educators that the CEA represents, I don't know of one who does not want to be in person with their students. An educator's best space in place is in the classroom with their students. but we have to be safe in order to do that well. And right now, our students are experiencing a lot of disruption with what's happening in the system. And again, a lot of that disruption is caused because of inconsistent decision making. And so we need clarity around how those decisions to go to in-person or remote or hybrid learning will happen. Yes, as I said, we want to be in person with our students, but there are definitely times where that's just not possible based on the data or based on the reality of the logistics of what's happening in a particular community. So we certainly did hear the governor say that, and we'd love to partner and work with the governor on creating that clarity and consistency around driving those decision-making metrics, as other states have done. But the governor has said that this will be a local decision, and so that is why we are now working at the local level with our local school leaders to provide that predictability and clarity to our communities, our students, our families, and our educators. And now I think I forgot the second part of your question. I'm sorry.
That's okay. Just wondering how far you're willing to take it to make sure that this message is heard and that y'all's safety is taken into consideration.
Sure. Our best and first approach is always to work collaboratively with our school districts. And we believe that our school districts will and want to partner with us. They too are experiencing a lot of pressure and stress and strain. As was mentioned, many of our superintendents and school board members, it's reached a level where they are getting threatening emails, some to the level of death threats. And so our goal is to come in a collaborative partnership way to ease the stress and the strain on the entire system, from our parents to our students, to our educators, to our school leaders. But we are willing to do what it takes to ensure the safety of our students and our educators. We believe that it shouldn't have to come to a level of a serious job action, because we should all collectively want to work together for the safety and benefit of our students. We have not, gotten to a place right now where we have asked our educators if they are willing to strike for this, but we do know that our educators are willing to do what it takes to ensure the safety of our students and their colleagues in the midst of a global pandemic. And I don't know if any of colleagues want to address that.
Sure. I just wanted to piggyback off of what you said earlier, Amy. Our schools have been a roller coaster of confusion and chaos since March. And we've been responding and reacting instead of getting out ahead of this pandemic to proactively and clearly tell our communities what the rules are and what to expect. We've been surviving, not thriving in this pandemic. And often when parents drop off their kids at school and hear from their kids that they had a great day, they assume everything went okay. But with the rise in COVID cases, many staff members are out due to illnesses and quarantines. And we don't have enough people to cover not just the classes, but all the necessary staff to offer our students a quality educational experience. So that's why this dial is so necessary, because we believe it's a simple metrics that tell us clearly what kind of learning to implement during different levels of community spread.
Okay, I believe Alex was next.
Hi, thank you. I'm actually not with a news organization. I'm on a board at a charter school in Boulder County. And I was wondering if you guys had suggested levels for the in-person, hybrid, or remote learning at the different levels on the dial, or if you wanted that to be negotiated on a particular district level.
Thank you. Yes, we do have numbers on the dial right now, but again, those are just for the sake of an example. We do believe that those numbers should be determined at the local level, because as we pointed out, there's different context within local areas, and so we think that should be worked out at the local level. But the point being that at the local level, it would be clear as to what each color on the dial meant, what it meant for our public schools. On the current state dial right now, it simply says suggested, in-person, hybrid, or remote. And so that leaves it up to a lot of subjectivity, and it's putting a lot of pressure and stress and strain on our local school districts to determine what that means or what that should look like. So we believe the dial should be more clear and specific at those levels is what it means for our schools, but that the local levels could work that out as to what those numbers should be.
Thank you, appreciate it.
Of course. I believe Tiny is next.
Yeah, thanks. I had another clarification about the percent positivity. Are you guys saying over time? You know, most of the data that we're looking at is either a 2-week rolling average or 3, 5, 7 day. Is there a specific time frame for positivity that you guys are suggesting?
I can field that. Honestly, I would suggest the 2-week time frame. If we're looking at moving and transitioning between different educational settings in a larger school district, from hybrid learning to remote learning or hybrid to in-person learning, that is something that is going to have to take a couple of weeks to set in motion. It's not something that we can do overnight. I think some of our districts have experienced that kind of yo-yo feeling throughout the entire fall semester of starting in one phase, moving to another phase for a couple of days, moving back a phase, moving forward a phase. This would give us data over a 2-week period that would give us kind of a aggregate view of what we can do and what we can expect. A little more predictability.
Yeah, absolutely. I get that. I guess my next question would be, then why would those thresholds need to be different between districts? If you're looking at a 2-week percent positivity rate, do you think it would cause more confusion if every district had its own different thresholds? Like, why is Cherry Creek's threshold 20% positivity rate when Jeffco's is only 5%?
Well, you know, as a social studies teacher of 20 years and starting my career off by teaching geography, I really looked at the population density when we were looking at this issue. And that's why I really reached out to Tiffany and to Brooke and to Mike, looking at the Denver metro area and the population density there, and then looking at Fort Collins and Pueblo and where we were. And I expected that we would be roughly a week or two behind whatever the Denver metro area was experiencing. And so you may see something in Cherry Creek look very similar to Adams 12, looking very similar to Jeffco. But if we're looking regionally, what is going to happen and work in Lamar is going to be very different from Fort Morgan or from Boulder or even from Fort Collins. And it gives that kind of flexibility.
Okay, thank you.
Thank you. Erica from the Colorado Sun.
Yes. Hi, everyone. I am just wondering, where is CEA in developing this dial? Are you proposing creating the dial right now, or have you actually created it? And then I'd like to know more about the role that CEA will play in updating the dial and what role local districts and local health departments will play.
Sure. So we have actually created the dial as a template that locals could use with their local school districts. Again, determining what numbers fit on the dial and what goes where within the dial. But the dial that the CEA created is a template or an example for our locals to utilize at the local level. And we have consistently been in agreement that our local school districts should be partnering with our local health departments to make these decisions. And so we would continue to encourage that local health departments be engaged with the school district, with the local educators, as they are filling in the numbers for their local community on this dial, again, with the purpose of providing clarity and predictability to students, families, and educators. Seth from the Denver Gazette.
Hi, guys. So it sounds like implementing this plan will require, buy-in from school districts and leaders. But at the beginning, of this press conference, there was some criticism for local school districts, some local school districts. So how confident are you that you're going to be able to get widespread buy-in from districts to work with the associations to implement this sort of independent metric? And kind of piggyback on Megan's question, if strike is sort of the last option, what are some of the escalation options to kind of force some of these districts to the table if they're not willing to participate? Thank you.
I've had conversations, just bringing up these metrics with some of my district leaders, and they seem very excited about it. Right now we're looking at too many metrics, and it's sort of muddying the waters. And this is a clear way that we can all communicate with our parents and our educators and prepare them for what's coming next. So, I don't think it's going to be too big of a struggle in Jeffco, because, I really feel like this is something that that our leaders want, so that they are no longer made to be the villains. And as Amy was saying, it goes back to the virus being the villain.
I can also speak to Denver, speaking with some of our school board members. Now that we've announced we're full remote, I think it's more important than ever that we need to know when it's okay to start bringing people back. And so in the absence of that, we're just going to be making guesses. Like, we need a real reason to know when things are safe. And the only data we're really going to have to base it off of is the community spread. So I think in the situation we're in, I do think our school boards and perhaps superintendents will be open to hearing some solutions.
I would more or less echo what Tiffany said, although we are having many different issues with our school board and district administration that has already been reported on in the Colorado Sun and other places. But when we come back after the winter break for the second semester, determining the thresholds for allowing students back in the building will be critical. And I think having a dial like this in place would ease that transition back into in-person learning without leaving so much arbitrary decisions.
Seth, I would just add, instead of focusing on, say, some escalation tactics, I really look at this dial with the metrics as a de-escalation tactic. It allows parents, it allows students, it allows educators, school districts, and school boards all to have a sense of predictability. And in the chaos that is this pandemic, I think that's what we all need.
All right, thank you. Laura.
Hi, thank you. I'm also a member of a local charter school board in Boulder County, and I was wondering how you determined that percent positivity was the best choice for your dial, as the Colorado dial has that as one of three metrics, and how you chose that one specifically. Thank you.
Right, I can address that one. So you're right, it is one of three of the top metrics, and we're always looking at all three of those metrics. My district up here has added a fourth and possibly even fifth metric that we're also keeping an eye on. And as I had mentioned earlier, we are looking at all those metrics together. But the reason we chose the percent positivity is based on the World Health Organization. They're using that. as well as many districts across the United States. New York City, with their 3% threshold that Mayor de Blasio talked about just yesterday, they are also using that percent positivity. There was a great article in the New York Times a couple of months ago that really talked on why many urban districts have chosen that 5% positivity threshold, the very same one that we were looking at the state of Colorado back when we began instruction this semester.
I'd like to add to that, right? So positivity rate is also used in California to help guide schools. But the positivity rate measures the true magnitude. Well, it measures whether we have enough testing being done to measure the true magnitude of the infection and to understand if rising rates of positive tests are the result of more people taking tests or of actual increases in coronavirus transmission. So by having a super high positivity rate, basically it's telling us we don't have enough information and that it's out of control. So I think it's telling us that we are truly in a place where we should be very alarmed. And so I think that's another reason to choose positivity.
Okay, Erica, Chalkbeat.
Yeah, thank you. There's been a lot of conversation in the past week about the quarantine requirements and how that's affected some of the district's decisions to go to remote learning. And I have heard from some superintendents that want to see the state change its quarantine guidelines so they don't have to quarantine as many people. And I'm curious where you all stand on that.
Well, I thank you for the question. I would, first say that we believe any changes to the guidance need to be based on science and clearly related to scientific evidence around if and why those changes should be made to the guidance. As of now, we believe that, as has been reported, is that there is low spread happening in schools, and that is because the schools are strictly implementing the school closure guidance that has come from the CDPHE. So if there were to be any changes to that guidance, we would say that it needs to be based in science and not driven, for other reasons beyond what is scientifically proven to be safe, to keep students and families and educators and communities safe. Anyone else want to weigh in?
And I'll just add to that. So we err on the side of safety and what will keep the most people safe, and that's what we want to strive for.
Thank you. Alex with a question.
I'm wondering if you would like to see a differentiation between the different age ranges, so maybe preschool through 5th grade, middle school, and high school for the level of in-person learning at the different locations on the dial. And if I didn't explain that well, please speak up.
I can maybe start with that one. I think, we're proposing that anything above 5% right now is right. It's highly alarming, should be remote. But I think once we get down below 5%, that's when we need to start looking at what are the most vulnerable populations of students that should be prioritized. But I think, yeah, that gets sort of into a more local decision level because it's looking at the different vulnerable populations within each district.
Can you just ask your question again? I just want to make sure I understood it.
Sure. My question kind of goes to the results that have shown that K through 5 or preschool through 5 students are less likely to to get the virus, where high school students have been shown to transmit the virus more readily. And so I'm wondering if you wanted to differentiate between the level of in-person learning for those different age groups along the dial. And that's kind of, I think, was the intention of the state with their new changes that they just put out.
Okay, thank you. So I think it's really important to remember that in elementary schools, students are not the only people in those schools. And we've already had a lot of problems just operating the elementary schools because, you know, the adults are getting sick and are out, and we can't keep them functioning. And we're not able to offer our students a quality educational experience because many of the adults are sick or out. The other thing is, you know, a lot of young children are asymptomatic. So unless we're doing direct testing at school, it's hard to know if they have the virus or not.
And I would just add to that, you know, we want to keep it simple. We want to keep everybody safe. That's why we don't want a different dial for each level. You know, we just want one dial. And, you know, kind of what Brooke was saying, here in Pueblo, the outbreaks in the schools have been most prevalent in the elementary schools, especially among the adults in the building. And so while the students themselves may be less susceptible to the virus and be asymptomatic, we've still had to put schools on remote learning, and for the reason that the adults in the building are getting sick and are unable to go to work. You know, so we have two sides that we have to keep in mind when we're talking about life inside a school building.
Thank you. And I'll just add, just kind of in relation to that, is the other benefit of having a dial like this that is clear, transparent, and known to everyone is it helps everyone to be a part of the solution, to be a part of doing what is needed. If we want to prioritize opening our schools to in-person learning, then we need everyone in the community to do their part so that our schools can safely be open to in-person learning. So if we know where the level is in our certain community and what that means for our schools, it gives us all the will and the goal to work together to do those things needed to get the percent positivity rate within the community to that place where we could have our schools open for in-person learning. So it's beyond just, you know, the school community knowing and having that predictability. It's about our entire community coming together for our public schools within our communities. So we have time for one more question, and I have Seth in the speaking order. So Seth will give you the last question.
Thanks. Just real quick, I think you guys referenced in the beginning that the dial, that 6% sort of top and then going down a little bit is an example. Is it just numbers kind of pulled out of thin air, or is it what you guys think is maybe an acceptable baseline? Just to put that number in context. Thank you.
So that number from the 6% onwards is when we started putting this together about 3 weeks ago, we were going off of suggestions from the World Health Order, but then also looking what was going on in the Metro Denver area. And so at that point, 3 weeks ago, for our placeholder numbers, we had already surpassed what the World Health Organization suggested as safe numbers for in-person learning. So again, just a placeholder of where those numbers came from.
All right, well, we want to thank you all so much for being here with us today and taking the time to listen to our stories and share our perspective. I want to remind everybody that this is really about our opportunity to do better. We have all experienced what has happened amongst and across our school systems this fall. And it is our hope that for our spring semester that we can all come together as educators, as school leaders, as parents, as students, as community members, to ensure that we have clear and consistent and transparent understanding of how decisions are being made and what those decisions mean for our students, families, and educators. We are here to partner on behalf of our students and public schools across Colorado. So again, thank you for your time this afternoon. If you have any follow-up questions, please feel free to reach out to Frank Valdez, our CEA Communications Director. Thank you for your time. Have a wonderful afternoon. Be well and take care.